I'd like to start with this question of the nanny state, actually, and what role politicians have, because Labour has slightly embraced this idea, which is counterintuitive for some in politics. And when you gave evidence to the Commission, you talked about the heavy hand of state regulation possibly being needed if businesses didn't pull their weight. But on the other hand, Labour wants to be seen as pro-business. So how do you square that circle, and how far are you willing to go to intervene to make the country healthier?
Yes, I'd say two things. I mean, firstly, Keir's done more than slightly embrace it. He went hard on taking on the nanny state argument. And so I'd just say, because I'm sort of sick of hearing this, that, oh, it's politics, it's politicians. I don't think politics can solve all of the problems in the NHS or in social care or in our public attitudes to health. But similarly, don't think that you can change things without politics. And when good politics is making the case, don't pretend all politicians are the same or all making the same arguments, because it's just not true. And when you've got the leader of the Labour Party, despite knowing the political risks that come with the attacks from the right on nanny state, actively saying, I'm going to take it on, don't pretend you haven't heard him, or you only heard the non-answer from the Secretary of State for Health. Support the people making the arguments and supporting the evidence, which is what the Labour Party is doing. The reason we've got a bill coming forward on smoking and vaping is because last January, no coincidence, when my comms political advisor was on holiday, Rachel coaxed me into an interview, which then made a big hit in that Saturday's Times, where I floated the idea of a New Zealand-style smoking ban, which, you know, we hadn't had a huge amount of discussions about in the Labour Party. I will now confess. And we've shifted the conversation to such an extent that a bill will now go through Parliament, thanks to Labour votes, by the way, because there's a conference going on elsewhere in London, sort of popular conservatism, which I thought was a slight contradiction in terms at the moment. But there you've got Rishi Sunak coming under heavy attack from within his own party to say, no, we shouldn't, you know, defending the right of kids to get addicted to smoking. So we will take on these arguments. And just, sorry, Rachel, you got my soapbox, but on this question of, like, industry, and I listened to what Chris was saying on his panel about the food and drink industry. I think, again, having kind of railed against tarring all politicians with the same brush, let me kind of avoid doing the same with food and drink. It is true to say that this is an industry that knows exactly how to influence politics, throw cash around to fund research that makes, you know, funnily enough, cases that support their commercial arguments. But there are also forward-thinking leaders in this space who are looking to us to create the regulatory level playing field they need to do the right thing. So my approach will be, and is currently, to build that coalition of the willing within industry and to make it clear to the rest, you know, you're not going to, it's not a question of leaders versus laggards anymore. You either get on board the steamroller or you're going under it. Because we will work with the leading figures in industry to make sure that when it comes to how you make fruit and veg more affordable, how you make sure you've got the right product formulation to promote healthier options, and how you make sure you give people the skills, the appetite and the affordability for healthy food and drink, we're going to work with leaders in the industry to drag the rest of us along with.
So retention is a huge issue in the NHS, particularly for GPs and other parts as well. What did you think of our idea for a loan forgiveness scheme for new staff who stay in the NHS? So we said 30% for 3 years, 70% for 7 years, 100% if you stay for 10 years. Because we heard that people just graduating are going off to Australia, New Zealand, Canada, and they're not giving back to the NHS.
I was sent yesterday a poster on a bus stop outside one of our hospitals, actively encouraging staff at that hospital to go overseas. And the message, in fact, I should just read it out, and I'll share it with you as well, and you can put it in the Times.
It's sort of come on in the
first for breaking
lovely,
news. Yeah. It says here, care for others in a place that cares about you British Columbia is working to move healthcare careers forward. And I was really worried about that for two reasons. Firstly was the obvious naked attempt to poach our staff. And I met plenty of them when I was in Australia before Christmas. Always tempted to kind of take extra luggage and throw people in and bring them back. But secondly, they are tapping in to how people are feeling working in the NHS at the moment, which is you are not valued. And that is really, really dangerous. And I've heard this suggestion around loan forgiveness put in a slightly different way, which is almost a sort of punitive, punishing way that says, you know, we're investing a lot in your training and you better stay working for us or we're going to hit you with a financial penalty. And I think that's completely the wrong tone. What I like about your proposal is it says we value you, we value the commitment you are making to our National Health Service and to our country. And as a result, and in recognition of the fact that as straight A-star students, you could have gone to any other high-paying industry or potentially anywhere else in the world, we're going to actively reward you with debt write-off, I think is a really attractive idea. The really important caveat I need to lay down before people in my team start frantically waving at the back and going like this is, you know, the reason I can't say today, I love it, you know, great, well, I can announce today a Labour government will commit to it, is for two reasons. Firstly, we need to consider these issues right alongside the breadth and complexity of higher education and student finance. And secondly, and even more fundamental, and you'll be sick of hearing this, I hope increasingly the voters hear this though, we know the public finances are really tight, there are difficult choices to be made, and everything that goes in our manifesto has to be fully costed and fully funded. And that's really important in terms of our credibility and being able to deliver. And if you're serious about a decade of national renewal, you know, before you even think about, you know, a decade, you've got to win a re-election. And so delivering what you say is really important. And then before you get to the re-election, there's the immediacy of the election. If there's one, probably a bigger opponent than the Conservative Party for the Labour Party this year, it's the other C, which is cynicism. And we have to make sure that when not just money is scarce, but trust in politics is scarce, that every policy we announce is one we know we can keep and we know that the nation can afford. And this would come at a cost. And so for that reason, I can't make an announcement or a commitment today, but this is grist to our mill, and you've made a convincing argument I think would resonate with lots of people who work in the NHS.
We're almost out of time, but I wanted to ask you before you go, there's a lot of talk in the NHS always about how funding is the solution, the strikes, you know, it may end up if there's an election before the strikes are resolved, you could be in government having to deal with that. Will you find more money for the junior doctors, for example, or actually is money not the answer to the NHS's problems? Is reform the answer?
Well, I've been quite hard on the NHS on the money because I don't think we have to convince people in the NHS or in the country at large that health is important and health requires investment. But when I started out as Shadow Health and Care Secretary, I did have to persuade people about reform. And in fact, even some of Labour's arch modernisers from the Blair and Brown governments were saying to me, don't use the word reform, it goes down like a bucket of cold sick. And I thought, well, that's even more reason to use the word reform because, you know, not only is it about a recognition that the immediate crisis today in the NHS can't simply be solved with more money, or even a recognition that money is scarce and that requires, you know, more focused choices. It's also a recognition that if you want a National Health Service that's free at the point of use, publicly funded through progressive taxation, you need to make sure that model is going to be sustainable for the decades to come. And so you've got to look at the way in which we organise health and care in the context of our growing ageing society, rising chronic disease and rising cost pressures, not just in health and social care, but right across the board. And I sit around a shadow cabinet table with a shadow education secretary that wants to invest in early years and life chances because she knows that's how you get working class kids from backgrounds like ours to achieve their potential. And I sit opposite a shadow defence secretary that's facing a world that looks even more dangerous than it has at any point in my 41 years on this earth. And that potentially requires greater investment in our military capability. So there are hard choices and growing costs. And so you have to think about the system you have in that context. You have to make sure that the money that's going in is well spent. And you can't tell me that when we organise health and care and how we prioritise within existing budgets in such a way that people can't get a GP appointment because there aren't enough of them, there are thousands fewer than there were, that would cost £40 for an appointment, and they end up in A&E costing £400 for an appointment, that we are currently using resources to best effect, and that is a problem, that one problem, £40 versus £400, is a problem that can only be solved with more money. And so it's in that context that I bang the reform drum even harder, because it's not just about investment, it is about reform. And that was the lesson of the last Labour government. And if you don't believe me, reflect on what Rishi Sunak said just this week, and forget the stupid £1,000 bet that he should never have agreed to and was pretty grotesque. He said something even more worrying and fundamental when he was asked about NHS performance. And he said, yes, we have broken our promise to cut waiting lists, but we're spending more money than ever before on the NHS. And I thought, right, so not only have you failed to cut waiting lists, you've spent a hell of a lot of money doing it. And I think it should be something, it is a sobering fact to concentrate our minds that we as a country have never spent more on the National Health Service, and yet the outcomes and the crisis has never been worse. So don't tell me this is just about more money. I am not naive enough to think that resources aren't an issue. But before we get to the obvious answer of more money that everyone finds comforting and they wrap themselves up in the comfort blanket and think, don't worry, the public will come to our rescue because they love the NHS, you've got to get on board with reform, because let me tell you, the public anxiety about the NHS is enormous. And on doorstep after doorstep after doorstep, I find people that simultaneously believe that money and investment is an issue, but they also see waste, inefficiency, and things that need to change through their experience as patients. And even more reassuringly, from my point of view, I meet people in the NHS at every level, the front line, leaders and clinicians, locally and nationally, who also feel that burning frustration that the NHS isn't as good as it could be and things need to change. And you know, your report is littered with countless examples of innovators, of people who are willing to think differently, who have that reform mindset. And that gives me the confidence to know that we can reform the NHS by taking the best of the NHS to the rest of the NHS. But it also tells me, when I have people say, but look, you know, you say the NHS doesn't innovate, look at what's happening at Guy's and St Thomas's with the hit list. And you acknowledge, you know, you highlight them in the report, and let me gently tell you that my local hospital at King George in Goodmayes has also trebled their capacity. They say they're more successful than Guy's and Tommy's, so I'm going to do a bit of local cheerleading. But I literally had someone from the NHS sort of wave the Times front page at me with a hit list to say, look, we do innovation, look. And my response was, OK, that's great. When you can do this in every hospital, not just the one I can see from my office window, then I'll believe that you have a culture in the NHS of innovation. You've got more pilots than the RAF. When you do adoption and roll out consistently and realise that potential of a single-payer system, then I will believe that we have an innovative, reforming National Health Service. But that's the challenge I lay down, and I think we can do that in partnership together.